This month, our Ag Week special report is Ag and Rural Development. A key piece of rural development is access to health care, and that includes emergency service. We take a look in this week's Ag Week cover story.
This is a group of people that work within a very dangerous environment all the time, and so for them, having that access is really important.
Farming is a dangerous profession, and every second counts in an emergency. That can be a challenge in rural areas. Christopher Arndt is the director of the EOTA Volunteer Ambulance Service. Besides farther distances, rural emergency medical services are facing other problems. He says a big one is having enough qualified EMTs.
EMS has historically been, in rural communities, a volunteer organization. And we know that EMS needs to be more on that professional level.
Arndt says as the rescue equipment becomes more technical and expensive, the more training is needed for EMTs. He says in order to attract qualified staff, they need to be paid. That's a challenge for nonprofit organizations that supplement the budget with fundraisers and community support. Much of that shortfall is because Medicare and Medicaid do not pay the full cost of calls.
We're only getting about 35 to 40% on a bill that we send to somebody. We're only getting 35 to 40% of that payment back to us, and Medicare tells us that we just have to write off the rest.
AJ Gangler is the Assistant Director of Rural Ambulance Service in Southeast Minnesota. He says some rural ambulance services are forced to consolidate, making those rural distances even farther and putting lives at risk.
Which isn't the greatest thing, right? That you lose the time response to these rural areas, rural communities that is needed in maybe a life-saving moment.
You could read more in the next Ag Week magazine or at agweek.com. Thanks for watching AgweekTV on YouTube. Make sure to like and subscribe. We put out new videos every Saturday.